Good morning, everybody. It's Dr. Galvin with another post-night shift ER update. For those of you new to the broadcast, my name is Jeffrey Galvin. I'm a board-certified emergency medicine physician. I also run a precision and functional medicine clinic in Charlotte, but I still work in the emergency department. I've been doing this for about 25 years, and I've been doing updates about COVID primarily, but also about other health-related topics, and we're going to probably start expanding those topics soon. COVID update. So numbers have gotten much better here locally. We're really have come off of the peaks we saw a month ago. Unfortunately, the situation in the hospital is no better. Last night, essentially, the emergency room was completely filled with admitted patients because of lack of staffing upstairs primarily. We just don't have enough nursing and staff, and that's in large part because of just burnout, and it's been a very difficult 20 months. And we've had a huge amount of staff loss because people are just burned out from working the acute side. Really, we haven't lost that many people because of vaccine mandates. I think in the system I'm in, there are 40,000 employees, and I think 400 of them, about 1%, decided not to get vaccinated. So that hasn't been a huge factor, but the burnout has been also for our nursing staff. Our younger nurses many of them are taking these very high paying travel jobs because there's a shortage all over the place. And if you're willing to go out of state or whatever, you can make quite a bit of money. And especially for our younger nurses that maybe are single and don't have family commitments here, the thought of going someplace else and maybe to a really cool city and for a couple months and making great money. I mean, I can completely understand, and if I were in their shoes, I'd probably consider doing the same thing. But there's all these things that have kind of accumulated, and so now I have a night last night where basically every single room in the emergency department is filled with admitted patients, and there's no place to see them, and we don't have enough staff to expand into the hallways and things like that. So it's a little bit like trying to empty a swimming pool through a straw. And it's just a nightmare for all those involved. It's a nightmare for the patients, and it's a nightmare for the physicians. I'm going to give a quick little overview about where we are here, almost 20 months into the pandemic, and where do we stand? And worldwide, so far we've had about 247 million cases, 5 million deaths. In the U.S., about 46 million cases and 750,000 deaths. So 750,000 Americans have died of COVID since basically February of 2020. Now, that's a huge number, but how does it compare to other numbers? Well, interesting, I did a little bit of research last night. The Spanish flu between 1918 and 1920 killed 675,000. So we've lost more people from COVID than the Spanish flu in a shorter period of time. HIV and AIDS, there were 700,000 deaths so far from HIV and AIDS in the last 40 years since it showed up in 81. So COVID deaths in the last 20 months have exceeded that. Interestingly, every single war that we've ever fought in the U.S., total number of deaths in that is 666,000 people since the founding of the country. So we've exceeded those deaths since COVID started, and people are still dying of COVID. Luckily, in our area of the country, we've had a huge spike of cases, and now those numbers have dropped off. But there's always risks of other variants and things like that. And as I tell everybody, get immunized, but do all the other things that you need to do to kind of protect yourself. The current situation, for COVID here is not so bad. I'm going to keep the video short tonight because I'm working again tonight. I'll do another one tomorrow. But, there's another interesting thing that we've learned about COVID. And, and we've learned that the majority of the cases of COVID that are admitted to the hospital, and many of those are also the people that end up dying eventually, are ultimately linked to 4 medical problems. And those medical problems are obesity, diabetes, hypertension, and heart failure. So those 4 things are associated with the vast majority of people that are getting admitted to the hospital. Now, unfortunately, obesity is a huge problem in this country, and so that entails a large amount of the population. But regardless, addressing those things is a really good way of preventing admission and things for COVID. And we're going to sort of expand to that because that's one of the things I'm pretty passionate about at my clinic. And we have great success with weight loss by changing lifestyle, because diets don't work. And we'll talk a little bit more about that tomorrow. But for today, I just want to give you a little bit of an update, a little bit of perspective of where we've come so far, COVID, and I'm hopeful that we're sort of seeing some light at the end of the tunnel. Time will tell. We've got holidays coming up. People are going to be traveling, coming together, and I'm praying that we won't see another spike like we did last year in January, which was pretty severe. As usual, wash your hands, wear your mask where it's appropriate. Look out for yourselves, look out for your families, and please look out for everybody else. We're all in this together, and let's try to work together to prevent further spread. Take it easy. Good night. I'll see you in the morning.